Hi, my name is Tasha, and I will be performing the administration of subcutaneous injection skill video. To begin, you do want to make sure that you verify the orders from the provider. You are going to want to verify the 6 rights of medication administration, which is going to be the right drug, the right dose, the right time, the right route, the right documentation. You are also going to want to check and verify the order in the EHR. The orders that we're going to be doing today is going to be the heparin 1,000 units subcutaneously, which is going to be 1 dose, and that's going to be 1 ml. At this time, I will enter the patient's room, close the door behind me to provide patient privacy. I would introduce myself to the patient. I would confirm the patient's first and last name and date of birth, and then I would verify with their wristband. I will ask the patient if they have any allergies to any medications, food allergies, or any seasonal allergies as well. I will let the patient know that we will be giving them the medication heparin per their doctor's order. This medication is used to prevent or treat certain blood vessels, heart or lung conditions, or to prevent any blood clotting, especially used during any procedures. Some of the side effects will include headaches, vomiting, shortness of breath, and swelling at the injection site. I'll let the patient know that some adverse effects could also include some bruising or any excessive bleeding, and to let me or their doctor know immediately if they notice any of these symptoms. I will let my patient know that they might feel a slight burning or stinging sensation while the injection is being administered, which is normal and should subside shortly after the injection is given. Some of the side effects from the injection itself could include redness or irritation of the skin. They might even have some bleeding or a little bit of bruising as well. So at this time, I will be performing hand hygiene. I will apply my clean gloves. I will select the correct gauge and length of needle in the size of the syringe. This is going to be the 25 gauge 5/8 inches. If you were going to be doing this in a different room, you would also want to label the syringe with all of the patient information, name, first, last name, date of birth, my initials, date, time, name of medication as well. Again, I would check the EHR to compare the orders to the medication that I'm going to be drawing up. I'm doing this in the patient's room, so I will be preparing the medication. If I had a cap on it, I would remove it. This time I would open the alcohol swab and I would clean the top. I'm going to draw up the amount of medication needed, which is going to be the 1 ml. So this is going to be the air, and I'm going to place that and put the same amount of air into the bottle. Now I'm going to be inverting and drawing up the 1 ml of medication. You also want to make sure that there is no air bubbles. And you'll want to push up on the plunger, if so. There's our 1 ml. You also want to select the appropriate site. I'm going to be using the abdomen near the umbilicus. You'll want to clean the area in a circular motion, which is going to be about 2 inches inward and out, allowing it to dry and not touch it. So you want to. And so you never want to wave or do anything like that. You're going to want to verbalize if you see any bruising or inflammation or any edema. If you do see anything on the patient's skin, you're going to want to choose a different injection site. You will also want to palpate the site and avoid any of those areas or anywhere with masses or any tenderness. Again, you want to make sure that your needle is the correct size by grasping the skin fold at the site with the thumb and 4 fingers. So you want to make sure that that is, the appropriate size that you're going to want to do. You'll want to squeeze your area here. You'll place the syringe between the thumb and forefinger of your dominant hand. You're going to do it like a dart. with your palm down in this direction here. You will now hold the skin, which is going to be across the injection site, and we're pinching it with our non-dominant hand, just like this. You're going to want to inject the needle quickly and firmly. It's going to be at a 45 to 90 degree angle. So at this time we're going to want to release the skin, hold that down with our non-dominant hand, and slowly inject the medication. We hold it with our non-dominant hand to stabilize the area. Okay, we will now quickly remove the syringe and apply the gauze gently over the site. You do not want to massage the area. You're also going to want to apply a Band-Aid if needed. You will engage the safety, and then you're going to dispose of this into your sharps container. You do not want to recap any used needles. Make sure that is also a puncture-proof container as well. Now that the patient is all done, we are going to remove our gloves. We will perform hand hygiene. We're going to ask the patient if they have any questions. We will monitor them, closely after given the medication. We will document all of the medications that we administered and any findings that we had. And of course, if the patient needs anything, put their colleague near them. Thanks.